of that opinion say aye. Those of the contrary view say no. The ayes have it and the motion is carried.
The 2017 constitutional amendment raising the age of marriage to 18 for both boys and girls was a significant milestone. However, many cases of child marriage are still being reported. According to a recent child marriage report by UNICEF, about 46% of girls marry before the age of 18 and 9% marry before the age of 15. Such trends deprive girls of education. Having noted such challenges, the Yes I Do Alliance, which is a partnership between Plan, AMREF, Choice for Youth, Rutgers and KIT together with the Dutch Ministry of Foreign Affairs, came into being in Malawi. The alliance comprised of Family Planning Association of Malawi, Fpam, Center for Human Rights and Rehabilitation, CHRR, AMREF Health Africa, Center for Youth Empowerment and Civic Education, CSA, Center for Social Research, and Plan as lead organization. There were 5 pathways for the project, which Alliance partners focused on. Fpam focused on adolescent sexual reproductive health and rights. CHRR focused on social movement, advocacy, and lobbying with renowned expertise in legal issues. AMREF concentrated its efforts on provision of adolescent sexual reproductive health services. CSA implemented youth engagement activities, while Plan International led the alliance and also implemented youth economic empowerment activities. The Yes I Do project was implemented in Machinga in the area of Traditional Authority Liwonde. Machinga Area Development Committee Chairperson Foster Kowani says through the project, many girls have been urged to go back to school.
Yes I Do Alliance kuno kwasino chief Liwonde atithandiza kwambiri. Chifukwa choti isanafike zaka zambuwezi. Mafigures yana monga mwenda fotokozera kuyamba paja makhala okwera kwambiri, ena kukwatiwa, ena kusiya sukulu panjira. Ndiye panopo zaonesa kuti ana skulu ambiri akuphunzira ndithu skulu, akumaliza achitsikana skulu. Anyamatanso nawo achimvesa ndithu achinyamata kuti akungunda nsikana amene ali pa skulu si chinthu chabwino. Zonsezi ndithu zachitika kudzera mu Yes I Do Alliance. Komanso pita pamenepo achinyamata athu amene anasiya skulu kunoko kwasino chief Liwonde kuti ena analekeza panjira ka form 2 ena form 4 kumaliza. Alliance imene yapanga kuthekera kuwaphunzitsa anyamata aja ntchito zamanja zimene akhala kugwira. Chimenenso chili chinthu chopambana kwambiri chifukwa maluso amene alandira anyamata amene wawa ndi maluso oti awathandizirabe mpaka kutsogolo ngakhale project itatha. Chabe kuti muliri wa COVID-19 kubwera kwa muliri umene kwakhangati kwabwezeresanso nkhani ya achitsikana aja kuti tachite encourage abwereso ku school. Chifukwa cha mauthenga amabwera mosiyanasiyana. Mauthenga kumudzi kuno momwe amamvekera ena mafotokozo zoti kubwera kwa COVID-19 ndekuti basi dziko likutha. Ndiye achitsikana ambiri amene anali pa school komanso anali ndi mtima amene tinalimbikitsa ife ngati amagulu kudzera ku mauthenga amene akhala kutipatsira Yes I Do Alliance. Amakhala anaja akusweka mitima kuti ngati dziko likutha ndi zinthu zovuta kuti mwina mwakene ndikangomwalira mwina ndisanalowe mbanja kapena ndisanapezeko mwana. Ndi ambiri atsikana athu anakhanga tanabalalika, ena kukhanga tino lowa mchitidwe ogonana kachiwiri mwina osaziteteza.
If it were not for the Yes I Do project, Martha could not have been in school. She was impregnated while she was in Form 2. Martha's mother, Felista Jugumbotso, says through the youth championships, Martha was encouraged to go back to school.
Paine chinandiwa wachifari mwana anali ali Form 2. Ndekuti asile school bajira kumaso kuyangana ndi zaka zake anali atangotha umene zaka 15. Ndekuona be kuti chaka cha 15 mwana kuti akhale pa khomo ndingomvomera mwina abereke akachira abwerereso ku school. Ndeti nakhali ukamba naye mbuyo mosemu ayiwo ku school koma kufuna kapena kufuna kubanja ayi ne panopa ndioneka ndikachira. Nde bambu wake so tirakhala pasi tinaona kuti ukufunsa mafunso ndipitaso ku school. Nde Martha uja anavomereza kuti amayi apapa ine ndipitaso ku school.
Patricia stumbled on her dreams too. Without any awareness of family planning methods, Patricia got pregnant when she was in primary school. She dropped out of school. On 25th December, she gave birth to a son. Patricia named her son Chris as he was born on Christmas Day in Malawi. Martha is one of the girls that have been motivated to go back to school. To reverse the problem that young girls are facing, Fpam sought to promote the welfare of young people in Machinga. Fpam project coordinator Jimmy Gajale says the project was implemented in the area of Traditional Authority Liwonde because of many reported cases of child marriages in the area.
So the Yes I Do Alliance saw it wise with the nature of the project to target Machinga District, particularly Traditional Authority Liwonde, based on the high prevalence rates of child marriages that was there at the time the project was beginning. That was in 2016, but also the high prevalence rates of teenage pregnancies. We're also considering other factors like high school dropout rates amongst young girls and boys. So this was basically what necessitated the Yes I Do project to be implemented in TA Liwonde. The whole aim of implementing the Yes I Do project was to ensure that we achieve, through working with the various community groups that we work with in the community, firstly we wanted to ensure that the community members as well as gatekeepers have changed attitudes as well as take action to prevent child marriages and teenage pregnancies. Secondly, what we wanted was to ensure that adolescent girls and boys are meaningfully engaged to claim their sexual reproductive health and rights right there in the community. Thirdly, we wanted to ensure that adolescent girls and boys take informed action on their sexual health. And fourthly, we wanted to ensure that adolescent girls have alternatives beyond child marriage and teenage pregnancies through education and economic empowerment. And lastly, we wanted to ensure that policymakers and duty bearers develop and implement laws and policies with regards to child marriages and teenage pregnancies.
Fpam Director of Programs Tazirwa Chipeta says young people were mobilized to address issues of teen pregnancies, child marriages, and sexual reproductive health and rights.
Just to mention that on this project as well, we were working with other partners because it was an alliance and every component had its own expectation. For Fpam, our largest component was to build the capacity in terms of giving out youth-friendly health services by different facilities at government level and at community level, but also wanted to strengthen the comprehensive sexuality education package amongst the teachers and the youth themselves. So we did our part, and other partners like Plan International, CSA, and everyone were able to also cover their part as well.
Through the project, young people, particularly adolescent girls, have been empowered to make informed choices about their sexual and reproductive health and rights, exercise leadership, and participate in development at local level.
Before kubera Fpam tinali mbuli kwambiri muzochitika zokusana ubereki ndi uchembere wabwino kunena zoona koma chifukwa cha upangiri umene Fpam inatipasa maboksi anasiyana pa ubereki ndi uchembere wabwino tikumva kukoma ndipo tikumazisapa ndipo panopa ndife achinyamata kuti sili chosundikayi. Fpam yasintha zinthu zingapo tinali mumbuli wa zochitika pa nkhani ya ubereki ndi uchembere wabwino panopa tikuziwa choyenera kuchita chifukwa cha upangiri wa Fpam from 2016 up to now.
tukanandika president kazi tumbuya katumba amapezeke koma mine information ndimene mapano imavuta kuna kuti wachinyamata atha kupita phabu kuchipatala nkumakatenga njira kwa maliliro kapena sokona kuti anthu amene kati komiti angotenga njira kwa maliliro kumakhala kovuta koma chifukwa cha information imene nabwera ndikwasintha anthu mapanizidi kufuna anthu akupha kutenga kwanu akutenga njira kwa maliliro naso zitopeze kwanga tunaweza kupote muna kwenda mkati challenge ya usiku na kuruka au kwa wewe tunakwenda muna kurudi.
Through youth clubs, young people like Martha and Patricia have a circle of helpful friends, teachers and community leaders who support them to return to school. Beyond that, young people are now aware of various family planning methods, an opportunity that was not there before. In line with the African Union Maputo Plan of Action on Sexual and Reproductive Health, which was adopted in 2006 in Mozambique, Fpam has been in the forefront in supporting the Malawi government to revitalize the provision of family planning services across Malawi. Using the Yes I Do project, Fpam increased family planning awareness to young people. Fpam has trained community-based distribution agents, CBDAs, who in turn take the services to the people, including the youth. Today, young people in Machinga, especially girls, are more optimistic of a brighter future and realizing their dreams than before. Through capacity building, child protection committees and traditional leaders are working hand in hand in popularizing the law on child marriage. Communities under TA Liwonde have formed their own bylaws regarding ending child marriages. TA Liwonde champions this agenda among his subjects.
Buku limene la malamulo lija limene buku la tesa kugwandiza mwakwati kuja buku muli malamulo ambiri limene kutoka basi malamulo alichoncho kati ochita makani osagulisa malamulo mbusi osatiri nyosi.
According to district council officials, the Yes I Do project has helped youths in Machinga dream further and push them towards their dream. Machinga Deputy District Youth Officer Sharon Kumembe says many youths have benefited from the project.
Before we had less providers, we had inadequate providers who were trained in sexual reproductive health. So we also had a loss in service delivery, where the youth could go to youth-friendly health services and they could not access the services of SRH or FP. So right now, Fpam managed to train what we call YCBDS, which are agents, youths who are trained in sexual reproductive health in service delivery. At first, we had youth working long distances to access family planning services at the health center, but due to coming of Fpam, they have trained what we call YCBDS, which means the youth are no longer traveling long distances to access their family planning services, but they are able to get it in their localities.
Deputy Youth Coordinator for Machinga District, Kenneth Nkandawire, concedes that the Yes I Do project has helped youths in Machinga. He says this is evidenced by statistics.
Currently, we have seen a rise in demand for services, YFHS services. For example, currently the proportion or the percentage of youth accessing YFHS services, we are at 44.3% of the youths now in the district are able to access youth-friendly services according to the data which we have basing on our reports. Out of this, we have challenges, more especially in uptake of some other services, more especially modern contraceptives. We are still working tirelessly on that. We are blessed that we have some partners who are helping us on that, but the figures are too low. Like currently, the percentage or the proportion of youths accessing modern contraceptives is too low at 27.4%. Possibly that's why we have got a lot of teenage pregnancies in the district. Like for the teenage pregnancies, I think the figures are always high in Machinga, and with the coming in of COVID-19, it just worsened the problem. We hear that the figure now, it went up almost by times 10 compared to the previous number which we reported. Currently, the same period of about 7 months, we have recorded about over 2,000 teenage pregnancies.
For Fpam, the Yes I Do project allowed them to collaborate with various partners and thereby achieve more in transforming people's lives and significantly improving the delivery of sexual reproductive health to the most marginalized groups of people. As explains Fpam Executive Director Donald Makwakwa, many young girls in Machinga now know their sexual reproductive health and rights.
In terms of the project, the Yes I Do, as an organization, we are very much satisfied with the progress made to date. It's unfortunate that as we're talking about progress, the project is also coming to an end. But otherwise, I think us working with the structures in the communities in the district, we are very much satisfied with what so far the project has achieved, and we're also sure that if these structures continue to work, the benefits of the project will continue to grow over time. Like in any other sector in Malawi, COVID-19 has impacted negatively on the work that we do, especially because we are talking about the project that was focusing on reducing teenage pregnancies as well as early marriages. As a result of COVID-19, in Malawi, schools were actually closed, and young girls remained out of school for quite a very long time, and others were tempted to enter into early marriages. And also access to sexual reproductive health was impacted negatively because the decisions were made to decongest some of the health facilities. As a result, services that were made available to the youth, particularly young girls, were no longer available during the period of the COVID-19 response. As a result, in terms of some of the gains that we had registered, began to be eroded because we saw young people getting into early marriages as well as others getting teenage pregnancies. As an organization, our work is also aligned to ensuring that we support the government to achieve the sustainable development goals. Particularly, we are looking at SDG 3 and SDG 5. We are talking about universal access to healthcare, but also ensuring gender equality. We believe that gender equality cannot be achieved if we don't support young girls, particularly through their access to education, access to healthcare, and access to all other social services. So as part of this project, we believe that we have supported the government to contribute towards the achievement of these SDGs.
The Yes I Do project, which ran from 2016 to 2020, has made young girls decide if and when and whom to marry, and if, when and with whom to have children. The project has also protected many young girls from child marriages and teen pregnancies.
Yes, I do.
Yes, I do.